hopefully, if that is the case in your home, you don't end up with acid reflux or even worse, GERD. But if you do, this is the guy you'll want to see.
Dr. Peter Janu is here from Fox Valley Surgical Associates. Good morning to you.
Good morning.
Good morning. Thanks for having me.
Let's talk a bit about something called GERD.
Sure.
What is that?
So normally the stomach is supposed to hold the contents when you eat it, but when it's going the wrong direction, that's when people have problems. And typically people suffer from either things like heartburn or chest pain, but sometimes people have the feeling of acid going the wrong direction or coughing, hoarseness. There's all sorts of different symptoms that people can experience from it.
Do we know what causes it?
Most of the time it ends up being a failure of the valve that's supposed to seal the contents within your stomach. Okay. And that can come from age or doing too many jumping jacks or pregnancy, any number of things. Sometimes people can be born with a valve that just doesn't work particularly well. And most of the time people will take medications to try to cover up those symptoms. That's the typical thing because most of those medications are over the counter nowadays. But invariably, over time, those medicines don't work as well because it's more of a mechanical issue with the valve.
Sure.
How common is this, and what are the risks of GERD if it is not treated?
Surprisingly common. So if you go to, whether it's the Walgreens or the CVS or any pharmacy, there's a myriad of different choices that you can choose. So the statistics are that 1 in 5 people in the United States suffer from some degree of reflux. There's about 21 million people in the United States that are taking medicines on a regular basis. And the problem is that with that constant irritation, it can increase the risk of developing either ulcers or pain or even cancer over time.
Let's talk a little bit about those over-the-counter medications because there are risks, right, of staying on them for long periods of time.
Correct. Initially, people thought that they were pretty innocuous, and they're, for the most part, pretty safe. But over time, when people are taking it for years and years and years, there's the potential risk that it can affect your kidneys, it can affect how your body fights off infection. There's some theoretical risks of dementia or heart disease, those kind of things. And so as people are taking them for longer periods of time, that's when the risk starts to accumulate.
So you actually have some minimally invasive procedures that can help us fix this.
Absolutely. So traditionally, people would have a surgery where you would change the shape of the stomach, and it's effective, but it would come with some potential side effects like trouble swallowing or bloating and those kind of things. So we started doing some of these more minimally invasive approaches a few years ago, and it's targeted at doing it one of two ways. You can either replace it with the Lynx device, which is basically this little magnetic bracelet.
Yeah, I want to hold this up.
These are rare earth magnets encased in titanium, like when people get their joints replaced.
Sure.
And it's basically designed to go around the end of your esophagus and acts as a new valve.
Okay.
And the nice thing about it, in as much as it involves a surgery to place it, it's very permanent and does a great job of holding things in place.
Okay.
The alternative option, rather than having an implant put in, is that sometimes the valve can just simply be reconstructed by going through the mouth. It's basically a fancy sewing machine that we use to go inside the stomach. Doesn't require any incisions in most people. And by doing so, we're able to kind of reconstruct that valve from the inside and recreate that kind of flap valve mechanism that holds things in place.
That's called the TIF procedure,
That's the
correct?
TIF procedure,
Okay.
yep.
And are these outpatient procedures?
Outpatient procedures. The TIF usually takes about 25 to 30 minutes to do. The Lynx is a surgery that usually takes about 45 minutes to an hour or so to do. Usually people kind of have to watch what they eat for a little bit to kind of have their body adjust to having those things done. It's a little bit like having your tonsils removed or something like that, where you kind of stay on bushy stuff for a little while. And then usually people recover from it pretty well, and the vast majority of people are able to go off their medicines entirely, and the symptoms of reflux are cured.
Wow.
If you want to find out if these procedures could be life-changing for you, Fox Valley Surgical Associates provides care at 5 locations throughout the Fox Valley.
And you can find those locations at fesa-wi.com. 2 phone numbers locally, 731-8131, or toll free, 800-574-3872. Thanks so much, Dr. Janu.
Thank you.